Hello, everyone. It's an honor to be here presenting to you all today. My name is Nathaniel Lass. I'm a first-year medical student at Nova Southeastern University, Kiran Patel College of Osteopathic Medicine. I'm actually joined by my research partner, Jonathan Sprague, who's also in here. We'll be discussing a little bit about the lymphatic system function and flow, a key link in the understanding of Alzheimer's disease and the aging brain. So just a quick note, our review encompassed papers spanning from 2012 to 2023. We had two main parameters, one being that only primary articles were considered in the review, and then second, only papers with valid PMIDs were considered. So a little background, since the lymphatic system is such a new term, it bears much resemblance to the more well-known lymphatic system, being a major source of clearance and filtration, just like the lymphatic system, only it's highly specialized and localized to the brain. So in this review, we aim to highlight kind of the most current understanding of the interrelationships between the lymphatic system function and then Alzheimer's disease development. We also explored literature on how aging and lifestyle factors such as sleep or dietary intake may alter this function and then or exacerbate pathologies associated with this development. If we could take a second and look at the bottom left of the poster here, we have a graphic model of kind of the current understanding of how this system works, how it flows. So you'll see that CSF from the choroid plexus is going to travel para-arterially along these penetrating arteries that dive down into the cortex, where it experiences influx into and then bulk convective flow across the interstitial fluid. This is driven by mostly arterial wall pulsatility, and then it is facilitated by these polarized AQP4 channels you'll see here in blue. These importantly, these channels are localized to astrocytic end feet, and the astrocytes are in green there. So once this is there, it is then effluxed back out paravenously with metabolites and drains to often like deep cervical lymph nodes and the rest of the lymphatic system. So keeping this kind of in mind, I'm going to let Jonathan go a little more in depth on the key factors that we have highlighted here.
Thank you, Nate. So we commonly found three major factors, including AQP4 localization, sleep, and dietary intake, which are all impacting lymphatic system function and influence AD pathology. So the first major factor we examine is AQP4 localization. And as Nate has already mentioned, AQP4 channels are highly polarized and are localized to astrocytic end feet, and they function to facilitate the distribution and clearance of metabolites. We found that AQP4 mislocalization in humans is strongly associated with increased neurofibrillary and amyloid beta pathology, and is further associated with AD status. We also found that in AQP4 knockout mice, compared to wild types, showed reduced tau, ISF, and amyloid beta clearance, and also showed significantly reduced ApoE distribution, or apolipoprotein E. The second major factor we examined is sleep. So in humans, sleep deprivation results in increased accumulation of amyloid beta in the thalamus and hippocampus and may lead to mood worsening. In rats, sleep deprivation also resulted in increased accumulation of amyloid beta. This was due to sleep deprivation promoting amyloid beta production and reducing amyloid beta clearance via promoting the amyloidogenic pathway with BACE1 and reducing the non-amyloidogenic pathway with RAGE and LRP1 respectively. In APPS1E4 mice, sleep deprivation was also shown to synergize with apolipoprotein E sigma 4 genotype to exacerbate the deposition of amyloid beta plaques, decrease AQP4 polarization, and decrease microglial clustering around plaques. The final factor we observed is dietary intake, specifically the role of omega-3 fatty acids, or N3-PFAs, in safeguarding astroglial AQP4 channel polarization, thus preserving lymphatic system function. Researchers looked at resulting AQP4 depolarization and the effective clearance rates in mice when given amyloid beta injections. After these amyloid beta injections, wild-type mice, which did not have N3-PFAs, displayed a significant loss of AQP4 polarization. However, mice with N3-PFAs given either exogenously or endogenously, displayed less AQP4 depolarization and improved amyloid beta clearance. So in summary of all this, the lymphatic system function is impaired in AD pathology, with AQP4 mislocalization and amyloid beta accumulation being related to worsening pathology. However, we found that lymphatic system function is significantly upregulated during periods of sleep and anesthetization, thereby increasing waste clearance. This increased waste clearance is also seen in the presence of N3-PFAs due to their protective effects on AQP4 polarization.
Awesome, thanks, Jonathan. So kind of for the why does this matter? We wanted to highlight basically that we chose these points because we found them to be highly relevant factors in the broader context of looking at sort of the glymphatic system and its components as being a novel target for future therapeutics and preventative use. So the literature surrounding the glymphatic system, sort of as a conduit or pipeline, as you will, in the pathogenesis and prognosis of AD, and honestly, many other diseases we didn't highlight here, but that the literature is constantly expanding, and there were quite a few papers that were published actually as we were working on this. But it offers a hopeful glimpse into the future possibility of more effective proactive treatments for a disease that, as we know, not only puts a high strain on the economy and healthcare systems, but on the 6.5 million Americans and their families that are suffering with this every year, dealing with it. And, that's only expected to double by the year 2050. So that's all. Thank you guys for your time. We're happy to answer questions.